we are talking about regression in autism. A good number of autism cases are diagnosed with the history of regression of the symptoms. Regression means the child had achieved the milestone of looking, listening, talking, socially interacting, usually till the age of 10 to 18 months, and after that he starts losing this milestone over a period of 2 to 3 months, and he presents to the doctor from 18 to 24 months of age with the history of regression of the milestones. Now let's understand how this regression occurs. When a baby is made or fetus is made into the uterus, the brain has started developing from the 4th week since the pregnancy, and from this 4th week millions of connections are getting formed into the brain. Now these connections are getting formed into the brain, and they keep on getting formed in 2 to 3 years of age in normal children. In these kids who have regression, these connections which are there, whatever they are formed in the brain, they are formed in the intrauterine phase, but since the birth of the baby, these connections have stopped forming. So whatever child develops the milestones of the child's development about the sitting, looking, listening, socialization, eye contact, they are developed based on the connections which are formed into the brain before birth. And after the age of 10-15 months, the child's connections which are there, they are not enough to learn new learning because the connections in these kids have stopped forming after birth. So in those children who had probably a birth related insult or virtual insult, most likely due to connections not getting formed after the birth due to this insult, these children will not have enough infrastructure of the connections to make the child look, learn and listen, the social connection and language based learning and human to human dynamic learning. And thus with the overload of the sensory system, with the overload of the learning, these connections start dying, and this is called synaptic pruning. And accordingly, the child is left with reducing socialization, reducing speech, and within 3 to 4 months, child presents like a autism case. Now, when a doctor sees these children, these connections needs to be reignited, reinitiated, and that can be done by the neuroplastic drugs and neuromodulators, which might help in developing the connections, and thus which may help in reversing the regression. Remember, all the autism kids are not regression kids. In good number of cases, the autism can be genetic, and it can be starting in the first week of the intrauterine phase immediately after pregnancy during the gestation, and in these kids the regression will not occur. They will be born with delay in the socialization and communication. Even their eye contact will be delayed, even their social smile will be delayed, their pointing will be delayed, their language will be delayed or may be absent. So this is the reason why we need to understand what is regression and how it is seen in autism cases. A lot number of therapists have a habit to keep on saying that child is regress after achieving some milestone, and that is not actually a true regression. They keep on talking about regression only when the child is in hyperactive, and just because the child is unsteady and hyperactive and violent, child stops learning new things despite the therapeutic or medicine related interventions. So in those cases, therapists use the word regress, but it is not so. Whenever you develop some milestones into the child of autism with the help of medicines or therapies, the milestones develop to some extent, and with that increased learning and increased IQ, the child develops curiosity and hyperactivity, and due to this hyperactivity, child loses the further speed of learning. It is not actually a true regression. The third type of regression which doctors have in mind, the pediatrists have in mind, is called neuroregression. In these cases, these children have progressively downhill course of the development after achieving some stage of development. Usually such kind of neuroregression seen in metabolic diseases which are long term and which are since birth or maybe enzyme related, and in these cases or sometimes after the infective encephalopathy, children exhibit such neuroregression.